Welcome to the Omni Dental Podcast.
Glad to be here. I mean, this is a really important one.
Yeah, it really is. So I want you to imagine, like looking in the mirror, you're flashing this bright white smile, and you just feel this total sense of confidence.
Right, like your oral health is just in perfect shape.
Exactly. No dark spots, no pain, everything looks totally pristine.
Hmm.
But what if that reflection is actually giving you a false sense of security?
Yeah, that's the scary part.
It is. Because today, we are taking a deep dive into, well, basically a shadow war happening in your mouth right now.
A shadow war. I like that. It's accurate.
We are unpacking this massive stack of notes and blog posts from Omni Dental of Arlington Heights to explore this hidden, silent threat to your health, and that is interproximal cavities.
Yeah, and for anyone outside the dental field, those are basically those sneaky, highly destructive cavities that develop straight between your teeth.
Right, and those spaces so tight you don't even think about them, until it's way too late.
Exactly.
So we're going to explore why the most dangerous decay happens completely out of sight and how modern technology spots it before you feel a thing.
It's just a fascinating area of oral biology to explore, honestly. And the materials we're referencing today, they come from a really authoritative source.
Yeah, they really do.
Just to give you some context on our foundation for this deep dive, Omni Dental is this great family dental practice based in Arlington Heights, Illinois.
Led by Dr. Billis Poles, right?
Yeah, Dr. Poles. And he brings over a decade of clinical experience to the table.
Yeah.
His expertise spans everything from, foundational preventive care all the way to complex oral surgeries and dental emergencies.
Which is super impressive. And looking at their practice details, their service area is huge.
It really is remarkably vast. They provide comprehensive care not just to Arlington Heights, but to all these surrounding communities, too.
Like which ones?
Oh, places like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
Wow, okay. That wide footprint really highlights their whole patient-first mentality.
Oh, absolutely. Providing that level of comprehensive care to so many communities requires a serious commitment to clinical excellence.
Which brings us right back to the invisible threat we are focusing on today. Before we can even talk about how a dentist finds a cavity hidden between two teeth, we really need to understand why these specific spots are such a massive vulnerability in the first place.
Yeah, the why is super important here.
Okay, let's unpack this, because looking through Dr. Pohl's clinical notes completely altered how I picture my morning routine.
Oh, really?
Yeah. I want you to think of the tight spaces between your teeth, like this microscopic fortress.
Okay, a microscopic fortress. I can picture that.
Right. So when you brush your teeth, the bristles of your toothbrush act like the toothbrush police. They're patrolling the wide-open outer walls.
Doing their job, keeping the exposed surfaces clean.
Exactly. But those bristles, they simply cannot fit inside the tight, barricaded alleys where two teeth press against each other.
Right, the bristles are just too thick.
Yeah, and because the toothbrush police can't get in, microscopic food particles and bacteria just accumulate there. They retreat into this fortress, completely untouched, and just feast on whatever sweet or starchy snacks we've been eating.
What's fascinating here is the underlying chemistry of that microscopic feast.
Wait, chemistry?
Yeah, because the big misconception is that sugar itself just sits there and directly rots the tooth.
Right, that's what I always thought. Sugar equals rot.
It's actually a much more complex biological process.
Yeah.
Our mouths are full of naturally occurring bacteria, right?
Okay.
So when those trapped bacteria inside the fortress consume fermentable carbohydrates like, the sugars from a soda or starches from a potato chip, they metabolize that food.
Okay, they eat it.
Exactly. And the byproduct of that bacterial metabolism is this highly corrosive acid.
Ew. So they are essentially metabolizing our snacks and sweating out acid directly onto the tooth enamel.
That is a very visceral image, but biologically it is spot on.
Wow, that's gross.
It is. And the location of this acid production is the critical factor. On the smooth outer surface of a tooth, your mouth has a natural defense mechanism. Saliva.
So saliva washes it away?
Yeah, it's constantly flowing, washing away food debris, and crucially, buffering and neutralizing those bacterial acids.
Ah, basically.
But inside those tight contact points between the teeth, saliva flow is severely restricted.
Because it's a fortress.
Exactly. The acid gets trapped against the tooth surface, and this initiates a prolonged, invisible acid attack.
A prolonged attack? Like, how long are we talking?
For hours. For hours after you finish a meal or a sweet drink, that concentrated acid is actively dissolving the mineral structure of your tooth enamel.
Hours. Just from one snack.
Yeah. And because the acid is locked in that tiny space without enough saliva to dilute it, the enamel at those contact surfaces erodes at a significantly faster rate than anywhere else in your mouth.
Man, it is genuinely unsettling to realize a slow-motion chemical erosion could be happening for hours while we are just, like, sitting at our desks working.
It happens completely silently.
Yeah, and if this acid attack takes hours and happens in a microscopic fortress where no one can see it, how do we even know it's happening before the tooth structure physically caves in?
That's the real challenge.
Because visual inspection by itself seems totally useless here. I mean, a dentist can't just shine a light and look in your mouth with a little mirror to see through a solid tooth.
No, they definitely can't. The naked eye is completely ineffective for interproximal cavities in their early stages.
Right, because it's hidden.
The decay is literally blocked from view by the surrounding healthy tooth structure. By the time a cavity between the teeth is large enough to be seen with the naked eye from the outside, the damage is already extensive.
Here's where it gets really interesting. Wait, so if I look in the mirror and my teeth look perfectly fine and white, I could still be harboring a secret cavity right now.
Yes. Looks are incredibly deceiving when it comes to oral health. You can have a brilliant, perfectly white smile and still have active decay tunneling into the sides of your teeth.
That is wild.
It is. And that is why dental professionals rely heavily on advanced diagnostic technology to breach those fortress walls.
Like X-ray.
Exactly.
Hmm.
The gold standard for locating these hidden threats is the bitewing X-ray.
Okay, I've had those. The little tabs you bite down on.
Right. These are specific, highly targeted digital images your dentist captures during routine checkups, typically every 1 to 2 years, depending on your individual cavity risk profile.
So what are we actually looking for on an X-ray? If the cavity is essentially invisible, how does a digital image detect a chemical erosion process?
It all comes down to radiographic density.
Density.
Yeah, tooth enamel is the hardest, most mineralized substance in the human body. Because it's so incredibly dense, it absorbs X-ray photons very effectively.
Okay, so how does that look on the screen?
It makes healthy enamel show up as a bright, solid white area on the digital image.
Got it. White means healthy.
But when those trapped bacteria produce acid and leach minerals out of the tooth, that specific spot becomes less dense. It loses its mineral armor.
Oh, I see.
So on the bitewing X-ray, these demineralized areas allow more photons to pass through. They appear as tiny, subtle, dark shadows or little wedges creeping into the bright white of the healthy enamel.
Oh, wow. So it allows the dentist to see the density of the tooth from the inside out.
Precisely. They're looking for shadows of missing minerals.
That makes total sense.
Mm-hmm.
But reading through the omnidental materials, they were using tools that go even beyond X-rays.
Oh, absolutely. Technology has advanced so much.
Yeah. I was reading about digital probing tools and more specifically laser fluorescence devices. I mean, lasers detecting cavities sounds like science fiction.
It really does sound like sci-fi, but laser fluorescence is just a brilliant application of physics in modern dentistry.
How does it even work?
Well, instead of using radiation like an X-ray, these devices emit a specific wavelength of laser light into the chewing surfaces and the contact areas of the teeth. The device then measures how that light reflects back. Healthy, fully mineralized enamel reflects light in a very specific baseline pattern. But enamel that is just beginning to lose its minerals, even before a physical shadow would show up on a standard X-ray fluoresces, or reflects light differently.
Wait, really? Before an X-ray can even see it?
Yes. The device can instantly quantify that difference. It catches the chemical breakdown of the tooth at a microscopic molecular level before a cavity has even fully developed.
That is amazing.
If we connect this to the bigger picture, what we are seeing here with OmniDental is a massive shift in the philosophy of dental care.
How do you mean?
Well, by emphasizing this advanced tech, like digital X-rays and laser fluorescence, they are moving away from reactive dentistry.
Like waiting for a problem to happen.
Exactly. The old model was waiting until a tooth broke or caused agonizing pain to fix it. This new approach is about highly proactive detection.
Proactive is definitely better.
And furthermore, it reflects a strong commitment to being an environmentally conscious practice.
Oh, because of the digital aspect.
Yeah, utilizing advanced digital imaging eliminates the need for the toxic chemical processing and lead foils associated with old-school X-ray film development.
And I never even thought about the environmental side of that.
It's huge. It aligns beautifully with sustainable practices while simultaneously improving diagnostic accuracy, procedural efficiency, and overall patient comfort.
That's a total win-win.
Yeah.
And finding these cavities proactively with lasers and digital sensors before they become physical holes in the tooth, it opens up a really fascinating timeline.
It really does change everything.
Which brings us to what the Omni Dental blog describes as the magic window.
Ah, the magic window.
Yeah, because our instinct as patients is to think, my teeth don't hurt, chewing feels fine, so I don't need to prioritize a dental visit.
That's classic human nature.
Right. But in the earliest stages of an interproximal cavity, sensitivity to hot coffee, ice water, or sweet foods
Right.
might not exist at all. You feel completely normal.
You'd have no idea it's happening.
Yet, if the dentist catches the decay during this silent, pain-free window, the treatment options are radically different than if you wait for symptoms.
The treatment pathways diverge entirely based on timing. Once the bacterial acid has dissolved enough minerals, the structural matrix of the tooth literally collapses.
So it actually caves in.
Yeah, a permanent physical hole forms. And that is the point of no return for tooth enamel. It cannot regrow once the physical structure caves in.
Yikes.
However, if you catch the decay in that magic window, the structural matrix, the scaffolding of the tooth, is still intact. It is just severely weakened and highly porous from the acid attack.
So what does this all mean? Are you saying a cavity can actually be cured or reversed without a drill if we catch it during this early window?
Well, we need to be precise with the clinical terminology here.
Okay, fair enough.
We are talking about reversing early enamel demineralization, not healing a full-blown structural cavity. But through a biological process called remineralization, the decay process can absolutely be stopped in its tracks without ever needing a drill or a synthetic filling.
That is just incredible.
It is. If Dr. Poles catches this early microscopic damage using laser fluorescence or a digital bitewing, he can prescribe or apply professional, highly concentrated fluoride treatments directly to the compromised area.
Let's get into the mechanics of that. How does swishing a gel or having a varnish painted on actually reverse chemical damage?
Fluoride is remarkably effective at a molecular level. It interacts directly with the calcium and phosphate ions that naturally exist in your saliva.
Okay, so it works with what's already in our mouths.
Exactly. When concentrated fluoride is introduced to that weakened, porous enamel, it acts as a catalyst. It draws the calcium and phosphate from your saliva back into the depleted tooth structure.
Like a magnet?
Very much like that. The fluoride actually integrates into the crystal lattice of the tooth, forming a new compound called fluorapatite.
Poor appetite.
Yes, and fluorapatite is even harder and more resistant to bacterial acid than the tooth's original hydroxyapatite matrix.
Wow, so it's actually stronger than before.
It essentially reconstructs and supercharges the microscopic damage, restoring the tooth's defensive strength.
That is so cool.
This raises an important question, though, for you listening right now. How often do you delay your routine dental checkups simply because your teeth don't currently hurt?
Probably all the time. People avoid the dentist.
Right. We are socially conditioned to associate the dentist with fixing pain. But the true magic of modern dentistry happens when you walk in completely pain-free.
I love that perspective.
A lack of pain does not mean a lack of pathology. If you wait until you feel a throbbing ache to schedule an appointment, you have missed that critical magic window entirely.
Which means you are moving from prevention to construction.
Yeah.
If you ignore it, you are looking at much more invasive and advanced treatments.
Significantly more invasive.
Yeah. Reading through Dr. Pohl's services at Omni Dental, I couldn't help but think of home ownership.
Home ownership. Okay, where are we going with this?
Hear me out. Ignoring early tooth decay is a lot like ignoring a small water stain on your ceiling.
Ah, okay. I see.
If you catch a leak early, you patch a few shingles. In dentistry, that's your remineralization or a very small composite filling.
Perfect analogy.
Right. But if you ignore that leak because it's just a little drip and it doesn't bother you much today, the water eventually rots the wood framing, destroys the drywall, and compromises the foundation of the house. You aren't patching shingles anymore, you're rebuilding structural walls.
The architectural analogy applies perfectly to the anatomy of a tooth.
So what happens if we miss that window?
If we track the biological progression of decay that misses the magic window, the enamel fortress falls, a physical cavity forms.
And that's when the drill comes out.
Exactly. The immediate solution is a composite filling, which uses advanced tooth-colored resin materials to restore the physical structure and aesthetic look of the tooth.
Okay, that's not too bad.
No, it's routine. But if that interproximal cavity is allowed to continue unchecked, the bacteria burrow deeper past the hard enamel and into the dentin, which is the softer, more porous layer beneath.
And once they are in the dentin, they are heading straight for the core of the tooth.
Straight for the pulp.
The pulp. That sounds painful.
It is. The pulp chamber is the living center of the tooth. It houses the blood vessels and the nerve endings.
Oh,
Yeah. When bacterial decay reaches the pulp, the tissue becomes highly inflamed and infected. Because this inflammation is happening inside a rigid, confined space, the tooth itself, the pressure builds up rapidly.
just throbbing.
Exactly. This pressure compresses the nerve endings, which is what causes that excruciating keep you up at night toothache.
Ouch.
At this stage, a simple composite filling is no longer an option. The infection is inside the nerve chamber. To save the tooth from being permanently lost, Dr. Poles would need to perform a root canal treatment.
Which involves physically going into the center of the tooth to address the infection, right? Can you break down what actually happens during that procedure?
During a root canal, the dentist creates a small access point to reach the pulp chamber. They carefully extract all the inflamed, infected nerve tissue and bacteria from the interior canals of the root.
Just cleaning it all out.
Thoroughly. The entire chamber is then completely sterilized to ensure no bacteria remain. Finally, the empty space is filled with a biocompatible material and sealed tight to prevent future infection.
So it saves the tooth.
Yes, it removes the source of the pain while allowing you to keep the natural structure of your tooth rooted in your jaw.
But what about the absolute worst case scenario? Let's say someone waits so long out of fear or lack of time that the structural integrity of the tooth is completely destroyed by the decay. Like it can't even be saved with a root canal.
In those severe cases, tooth extraction becomes a clinical necessity.
You just have to pull it.
The tooth must be removed entirely to stop the severe infection from spreading beyond the tooth and into your jawbone or bloodstream.
That's serious.
Very serious. But extracting a tooth creates a new set of architectural problems. The jawbone actually requires the mechanical stimulation of chewing to maintain its density.
I didn't know that.
Yeah, so when a tooth is removed, the bone in that specific area begins to resorb or basically melt away over time.
Oh, wow.
To prevent this bone loss and maintain your bite alignment, the extracted tooth must be replaced. Today, the standard of care for replacement is a dental implant.
Which is literally replacing the foundation of our house analogy. You're installing a new structural pillar.
Biologically speaking, yes. A dental implant involves surgically placing a titanium post directly into the jawbone.
Sounds intense.
It's advanced, for sure. Over several months, the living bone fuses with the titanium in a process called osseointegration.
So it becomes part of the jaw.
Exactly. Once fully integrated, a custom-made artificial crown is attached to the post, restoring full function and aesthetics. It functions exactly like a natural tooth root.
Knowing that Dr. Poles specializes in these complex surgeries and emergency extractions is really reassuring, actually.
Absolutely.
His extensive training allows him to handle these advanced surgical cases flawlessly, all under one roof. But looking at Omnidental's philosophy, it also highlights an incredible patient-first mentality.
How so?
Well, when they discuss these advanced treatments, there is a constant effort to balance clinical oral health, the long-term longevity of your natural teeth, and the significant financial investment required from the patient.
Balancing those factors requires deep clinical empathy, honestly.
Exactly.
Dental implants and root canals are profound, life-improving procedures. They eliminate severe infection, they restore the ability to chew pain-free, and they protect overall systemic health.
But they're a big deal.
They are. They require a substantial investment of time, recovery, and resources. Omnidental utilizes state-of-the-art technology to ensure these complex procedures are as efficient and comfortable as possible.
Right.
However, their ultimate clinical goal is always prevention. They want to equip you with the knowledge and care to avoid needing these surgeries entirely.
Which brings us to the most practical part of this deep dive, the daily defense.
This is the crucial part for everyone listening.
Because we've spent time exploring the high-tech lasers and digital sensors the dentist uses to find these hidden cavities, and the intense surgical procedures required to fix them. But preventing them from forming in that microscopic fortress between your teeth is actually a job you have to do at home, in your own bathroom, every single day.
It really is. The clinical technology exists to detect the damage, but your daily habits dictate the microbiological environment of your mouth.
Yeah.
And the single most critical habit for disrupting the environment that causes interproximal cavities is daily flossing.
Okay, I have to play devil's advocate here.
Let's hear it.
Everyone knows they're supposed to floss. But does running a piece of string between your teeth really make that much of a difference compared to all this high-tech laser stuff we just talked about?
Yeah.
I mean, why hasn't modern science given us a mouthwash that just does what flossing does? Why are we still using a piece of string like it's 1950?
It's a fair question, really, but it makes an absolute biological difference. To understand why string is still superior to a liquid rinse, we have to look at how bacteria organize themselves. They don't just float freely between your teeth.
Okay.
They build a highly organized, sticky structure called a plaque biofilm.
A biofilm.
Think of biofilm like a waterproof tent that the bacteria build to protect themselves.
Oh, sneaky.
Very. A simple liquid mouthwash cannot easily penetrate that sticky protective matrix. The only way to destroy that tent is through mechanical disruption.
Physical force.
Exactly. Whether you use traditional string floss, specialized interdental brushes, or a pressurized water flosser, the physical friction of cleaning that space tears down the biofilm.
That makes total sense.
You are mechanically scraping away the bacteria and the food particles before they have a chance to sit there and produce acid for hours.
So you were physically demolishing their protective tent and starving them out before the acid attack can even begin.
Flossing is the ultimate mechanical disruptor, but it is just one part of a comprehensive strategy.
What else should we be doing?
Well, while mouthwash can't easily break down a mature biofilm on its own, rinsing with a fluoride mouthwash after flossing is highly effective.
Because the tent is gone.
Exactly. Once the fortress walls are breached by the floss, the liquid fluoride can easily flow into those tight spaces, neutralizing any residual acids and providing a daily microdose of remineralization to the enamel.
We also can't ignore the fuel source, though. What we eat dictates how much acid those bacteria can produce. The omnidental notes specifically emphasize modifying our diets to reduce cold or sweet snacks.
Dietary modification is a massive pillar of prevention. Every single time you consume a sugary or highly processed carbohydrate snack, you are delivering a fresh fuel source to the bacteria.
Just feeding them directly.
Yep, and initiating a brand new multi-hour acid attack cycle. Limiting the frequency of those snacks simply starves the bacteria, preventing the acid production from starting in the first place.
Looking at the preventive care section of their clinical materials, I also noticed a heavy emphasis on dental sealants.
Sealants are a phenomenal preventative tool, especially for younger patients, though adults benefit as well.
What are they exactly?
They are thin, biocompatible protective coatings applied directly to the chewing surfaces of the molars at the back of the mouth.
Okay, the back teeth.
Right, because molars naturally have deep microscopic pits and fissures where bacteria love to hide.
Another little fortress.
Exactly. The sealant material flows into those deep grooves and hardens, physically blocking access. It makes the surface completely smooth and incredibly easy to clean with a standard toothbrush.
It's essentially paving over the deep trenches where the bacteria want to set up camp.
That is a perfect way to visualize it. And all of these daily, at-home habits flossing, fluoride rinses, dietary changes, they're designed to work in tandem with regular professional dental visits.
You gotta have both.
You do, because even with immaculate flossing technique, plaque can still calcify and harden into tartar over time.
And tartar is bad news.
Very bad.
Yeah.
Tartar is heavily porous and harbors massive colonies of bacteria, and no amount of at-home brushing or flossing can remove it once it hardens.
Only the dentist can get that off.
Right. Only a dental professional with specialized scaling instruments can safely remove tartar buildup. Your daily defense basically complements OmniDental's professional preventative care.
Teamwork.
Yes. You manage the daily mechanical disruption, and they handle the deep cleaning, the high-tech monitoring, and the professional strength fluoride applications.
It really is a true partnership between your daily routine and your clinical team. So let's quickly recap the journey we've taken through the research today. We started by exploring those hidden bacterial fortresses between your teeth, where toothbrush bristles just can't reach, and long, silent acid attacks eat away at your enamel armor.
The shadow war.
Right. We learned how simple visual checks fail, and why Omnidental relies on the physics of biting X-rays and laser fluorescence to spot microscopic, invisible changes in tooth density.
Proactive detection.
Exactly. We discovered the magic window, that glorious pain-free period where early detection means a cavity can actually be chemically reversed with professional fluoride, saving you from the drill.
The best possible outcome.
Definitely. Then we mapped out the severe biological consequences of missing that window, tracking the decay from the enamel into the dentin down to the nerve chamber, leading to root canals or surgical implants.
The serious stuff.
Yeah. But most importantly, we saw how the simple physical act of tearing down bacterial biofilms with daily flossing can literally save your natural smile, your jawbone, and your wallet.
The overarching theme of our discussion today is control. Your oral health is firmly in your own hands every single day through the hygiene habits you choose to build.
And in the hands of the pros.
Right, in the hands of compassionate, highly trained experts like Dr. Poles and his team at Omnidental, when you maintain those vital, regular checkups.
The clinical technology they use is incredible, the surgical treatments are highly advanced, but the foundational secret to maintaining a healthy mouth for a lifetime is just consistency.
Just showing up.
Consistency in your bathroom at home and consistency in the dentist chair.
We've seen today how bacteria can do so much unseen, silent damage in the tiny hidden spaces of our teeth over just a few hours. It makes you wonder, what other small, invisible habits in our daily lives might be slowly eroding our overall well-being without us noticing simply because we aren't looking in the right places?
That is a brilliant and provocative thought to leave on. The things we cannot see are often the things that impact our foundation the most, whether it's a microscopic fortress between our teeth or an unnoticed pattern in our daily routines.
Beautifully said.
Thank you so much for joining us on this deep dive into the hidden world of oral health. Keep asking questions, stay curious about the science happening inside your own body, and remember to protect those hidden spaces. We will catch you next time.